Welcome back to Calm Mind and Healthy Body, our channel. Today we're exploring a topic affecting millions worldwide: lowering blood pressure without medication. Understanding arterial hypertension is crucial, as it can lead to serious health issues if left unmanaged. In this video, we'll explore natural methods to help you control your blood pressure and improve your overall health. We'll start by discussing what hypertension is and why it's often referred to as the silent killer. Then, we'll share practical lifestyle changes, dietary tips, and stress management techniques that can significantly impact your blood pressure levels. You'll learn about the power of exercise, the importance of a balanced diet rich in fruits and vegetables, and how mindfulness practices can help you stay calm and collected. We aim to provide engaging and informative content that empowers you to make healthier choices. By the end of this video, you'll have a toolkit of natural strategies to manage your blood pressure effectively. So, stick around as we uncover these valuable insights and help you on your journey to better health. Before we dive deep into the main subject, if you enjoy our content, we'd appreciate it if you could subscribe and hit the notification bell. Hence, you'll be updated on health tips, recipes, and wellness inspiration. I appreciate your support. Understanding arterial hypertension. Arterial hypertension, commonly known as high blood pressure, is a condition where the force of the blood against the artery walls is consistently too high. This condition is significant because it can lead to serious health complications, including heart disease, stroke, and kidney damage. Essentially, when your blood pressure remains elevated over time, it puts extra strain on your heart and blood vessels, ultimately affecting your overall health. Hypertension is alarmingly prevalent, affecting nearly 1 in 3 adults globally. Specific populations, such as older adults and individuals with a family history of high blood pressure, are at a higher risk. Lifestyle factors like poor diet, lack of physical activity, and excessive alcohol consumption can also contribute to the rising rates of hypertension. The risks associated with untreated high blood pressure are severe. It can lead to life-threatening conditions such as heart attacks and strokes, which are among the leading causes of death worldwide. Additionally, chronic hypertension can result in damage to vital organs, including the kidneys and eyes. Understanding arterial hypertension is crucial for taking proactive steps toward better health and preventing these severe complications. Causes of high blood pressure. High blood pressure, or hypertension, can arise from various causes and risk factors. One of the most significant contributors is lifestyle choices. A diet high in sodium, saturated fats, and processed foods can increase blood pressure. Additionally, a lack of physical activity can weaken the heart and contribute to weight gain, further elevating blood pressure levels. Stress is another critical factor. Chronic stress can lead to unhealthy habits like overeating or excessive alcohol consumption, which can exacerbate hypertension. Genetic predispositions also play a role in developing high blood pressure. If you have a family history of hypertension, you may be more likely to experience it yourself. Environmental influences, such as exposure to high-stress situations or living in areas with limited access to healthy foods, can further increase your risk. Age and gender are additional factors that can affect blood pressure levels. As people age, their blood vessels naturally lose elasticity, which can lead to higher blood pressure. Moreover, men are generally at a higher risk for hypertension earlier in life, while women often see an increase in blood pressure after menopause. Understanding these causes and risk factors is essential for effectively preventing and managing high blood pressure. Symptoms and diagnosis. High blood pressure is often called a silent killer because it typically does not present noticeable symptoms until it reaches a severe stage. However, some common symptoms may indicate elevated blood pressure, including headaches, dizziness, shortness of breath, and nosebleeds. These signs can be easily overlooked, so regular monitoring is crucial for early detection. Regular blood pressure monitoring is essential for everyone, especially those at risk. It allows individuals to track their blood pressure levels over time and identify any concerning trends. Many people may not realize they have high blood pressure until they experience serious health issues, making routine checkups vital for prevention. Healthcare professionals use several diagnostic methods to assess blood pressure. The most common method is a sphygmomanometer, which measures blood pressure in millimeters of mercury, mmHg. A reading consists of systolic pressure during heartbeats and diastolic pressure between beats. In addition, doctors may conduct further tests, such as blood tests or electrocardiograms, to evaluate overall heart health and identify any underlying conditions. Early diagnosis and intervention can significantly improve outcomes for high blood pressure patients. Natural ways to lower blood pressure. Several actionable lifestyle changes can help lower blood pressure naturally. One of the most effective dietary adjustments is reducing sodium intake. Aim for less than 2,300 milligrams of sodium daily, or even lower if possible. Instead, focus on increasing potassium intake by consuming more fruits and vegetables, such as bananas, oranges, and leafy greens. This can help balance sodium levels and ease tension in blood vessel walls. Regular physical activity is another critical component in managing blood pressure. Aim for at least 150 minutes of moderate aerobic exercise each week, such as brisk walking, cycling, or swimming. Additionally, incorporating stress management techniques like yoga, meditation, or deep breathing exercises can significantly reduce stress levels, which can help lower blood pressure. Maintaining a healthy weight is also crucial. Even a modest weight loss can positively impact blood pressure. Lastly, avoiding tobacco in all forms is essential, as smoking can damage blood vessels and raise blood pressure. By making these lifestyle changes, you can take proactive steps toward better heart health and manage your blood pressure naturally. The role of nutrition. Nutrition is crucial in managing blood pressure and overall heart health. A diet rich in fruits and vegetables is particularly beneficial, as these foods contain essential vitamins, minerals, and antioxidants. Berries, leafy greens, and citrus fruits can help lower blood pressure by providing nutrients that support vascular health and reduce inflammation. One of the most effective dietary approaches for lowering blood pressure is the DASH diet, which stands for Dietary Approaches to Stop Hypertension. This diet emphasizes whole foods, including plenty of fruits, vegetables, whole grains, lean proteins, and low-fat dairy while significantly reducing sodium intake. Research has shown that following the DASH diet can substantially lower blood pressure, making it a popular choice for those looking to improve their heart health. Hydration is another important aspect of nutrition. Drinking enough water helps maintain optimal blood volume and circulation, positively influencing blood pressure levels. Additionally, limiting alcohol consumption is essential, as excessive drinking can raise blood pressure and contribute to other health issues. Focusing on a balanced diet and making mindful choices can effectively manage your blood pressure and promote long-term heart health. Exercise and blood pressure. Regular exercise is a powerful tool for lowering blood pressure and improving cardiovascular health. Engaging in physical activity helps strengthen the heart, allowing it to pump blood more efficiently, which can lead to lower blood pressure levels. Aerobic and strength training are two effective types of exercise for managing blood pressure. Aerobic exercises, such as walking, jogging, cycling, and swimming, elevate your heart rate and improve circulation. Strength training, which includes weightlifting and resistance exercises, also contributes to heart health by building muscle and enhancing metabolic function. To stay motivated, you must find physical activities you enjoy, whether dancing, hiking, or joining a sports team. Incorporating fun activities into your routine can make exercise feel less like a chore and more like a rewarding experience. For optimal results, aim for at least 150 minutes of moderate aerobic exercise each week, spread out over several days. Additionally, include strength training exercises at least 2 days a week. Consistency is vital, so establishing a regular exercise routine can significantly impact your blood pressure and overall well-being. By making exercise a priority, you can take meaningful steps toward better heart health. Stress management techniques. Managing stress is essential for maintaining healthy blood pressure levels. Various techniques can help you achieve this. Mindfulness practices, such as meditation and yoga, are particularly effective in reducing stress and promoting relaxation. Meditation encourages you to focus on the present moment, helping to clear your mind and alleviate anxiety. Yoga combines physical movement with breath control and mindfulness, making it a holistic stress relief approach that enhances flexibility and strength. In addition to mindfulness practices, deep breathing exercises can be a simple yet powerful way to lower stress levels. Taking slow, deep breaths can activate your body's relaxation response, helping to calm your mind and reduce tension. Techniques such as the 4-7-8 breathing method, where you inhale for 4 seconds, hold for 7, and exhale for 8, can be particularly beneficial. Moreover, social support and healthy relationships cannot be overstated. Connecting with friends and family provides emotional support, which can help buffer against stress. Engaging in meaningful conversations and spending quality time with loved ones can enhance your well-being. Incorporating these stress management techniques into your daily routine can lower your blood pressure and improve your quality of life. Monitoring your progress. Tracking your blood pressure is essential for understanding how well your management strategies work and making necessary adjustments. Keeping a blood pressure log is one effective way to monitor your progress. This log lets you record your readings, helping you identify patterns and changes. Noting the date, time, and any relevant factors, such as diet or exercise, can give you valuable insights into what influences your blood pressure levels. Regular checkups with healthcare providers are also crucial for effective monitoring. These appointments allow your doctor to assess your overall health, review your blood pressure readings, and provide personalized recommendations. They can also help identify any underlying issues needing attention, ensuring you stay on track with your health goals. For added convenience, consider using a home blood pressure monitor. These user-friendly devices allow you to take readings in the comfort of your home. By regularly measuring your blood pressure, you can stay informed about your health and make timely decisions regarding lifestyle changes or medical interventions. Combining a blood pressure log, regular checkups, and home monitoring can empower you to take control of your blood pressure management effectively. In this video, we explored various natural methods to lower blood pressure without medication, emphasizing the importance of lifestyle changes for long-term health. We discussed the significance of a balanced diet rich in fruits, vegetables, and whole grains, along with the benefits of the DASH diet. Regular physical activity, including aerobic and strength training exercises, was highlighted as a critical factor in managing blood pressure effectively. Additionally, we covered stress management techniques such as mindfulness practices, deep breathing exercises, and the value of social support in maintaining emotional well-being. Remember, making these lifestyle changes helps lower blood pressure and enhances your overall quality of life. By incorporating these strategies into your daily routine, you can take proactive steps toward better heart health. If you found this information helpful, we encourage you to subscribe to our channel for more health content. Don't forget to like this video and share it with friends and family who may benefit from these tips. Your engagement helps us create more valuable resources to support your health journey. Thank you for watching, and we look forward to seeing you in our next video.